My name is Anna Maria Rapetti. I am the Vice President and Chief Development Officer at UT Health San Antonio. I've had the great good fortune to be here 3.5 years. I hail from Southern California, don't say boo, and I'm so pleased to be here in Texas with all of you. Before we start, I would like to introduce Dr. David Cadena, who is with our Concierge Hill Country practice. David, if you could stand. And his practice manager, Joanne Rios. They have more information if you're looking for a fabulous concierge doctor that's close to home. They take care of all of your needs 24/7, so please talk to David. They will be here throughout the evening. Now I'd like to introduce to you our moderator for the evening, Dr. Jennifer Potter, Senior Vice President of Research for UT Health San Antonio and Interim Vice President for Research at UTSA. Please welcome to the stage, Dr. Jennifer Potter.
Thank you, Anna Maria. I, too, am very excited to be here. I like the tone of the crowd. It sounds like we're going to have a lovely evening, and we're just delighted. So, truly an honor to be with you tonight. As someone who's had the privilege over the past several months to serve both UT Health San Antonio and UT San Antonio and the research mission, I've really been struck by the remarkable momentum that we have. So we are heading towards opening the doors of a brand new university, one UT San Antonio, September 1st. That's the combination of two R1 universities, truly an extraordinary event coming in San Antonio. Tonight is more than just a conversation. It's an invitation to be part of something truly, truly transformational for our universities, for the health of our community, for discoveries, for the pride of San Antonio and what we represent here in South Texas. To that end, we are going to be defining what is possible in education, research, and healthcare. And so with that, and without further ado, I'd like to invite Acting President, Dr. Taylor Eighmy, and Senior Executive Vice President for Health Affairs and Health Systems, Dr. Francisco Cigarroa, to join us on the stage, and we'll begin our discussion. I'm getting used to that.
It's contagious.
It is.
High fives are the new fist bumps. Okay, so let's start off. Obviously, you know many of the folks in the room, but not necessarily everyone, and they need to learn a little bit more about what we're doing here. So I think to start it, let's talk about this defining moment, as I mentioned earlier. Can you both share why you decided to take on your leadership roles in this merger and our future institution?
Well, I'm sitting next to the consummate leader here, and before I dive in, I just want to share that it's a delight to be here and to have this conversation with you. And I'm so lucky and fortunate because I'm in a job that I love, but I get to work with amazing, incredible people who are wonderful leaders. They have immense acumen, they have passion, they're incredibly insightful, they are audacious in their big ideas, and they believe deeply in the purpose of our new university that we're creating. And you can tackle any problem in the world when you're surrounded by talented colleagues like that. So if you are working at either UTSA or UT Health San Antonio, would you stand and be recognized? Because I want to give you a shout out. There are a bunch of you in the room. Thank you, thank you. Thank you for what you do. All right, what was the question again?
Why here, why now, why you?
Yeah, in some ways, having grown up in New England and spent a lot of time at different institutions, being a researcher, being a faculty member, I ended up migrating towards leadership by accident. I would end up getting selected to work on things that were complex and hard, and they worked out, and people kept saying, go ask Taylor to help you with it. And I ended up doing these things, and I enjoyed doing that. I loved building and solving problems and creating things that were impactful. And but I never imagined in my entire life that I would be a president of a university. But I did care about all of this that we do, and education is so important, and discovery is, and making lives better. All of those things are really essential. But I came to it through the path of being a researcher and then becoming a senior administrator to advocate for research. And it ended up taking me to a bunch of different places, and one of them was to be the vice president for research at Texas Tech. And the president then was Dr. Guy Bailey, who used to be the provost at UT San Antonio. I see many of you nodding your head. He's now the president at UT Rio Grande Valley. And he went off to be, after Texas Tech, he went to Alabama, and then he came back to Texas. And he was the first person to say, Taylor, you need to be a president, and you need to be the president when the time is right at UT San Antonio. And I was like, great, let me understand this. So I used to spy on this place a lot when I was at Texas Tech. And then when Dr. Romo decided to retire, I said, I'm going to throw my hat in the ring. And I ended up making it through that process. And there were some important people on the search committee that hired me. One was Bill Henrich. And Bill and I became very, very close from that process going forward. I always kidded him because he asked me the hardest question in that whole process of going through the search. And we used to joke about it. But there was another person, there were other people that were on it that were very important, but this guy to my left was also on the search committee.
I asked you the easiest question.
You did. I was about to give you credit for that. So I find myself here today deeply believing in what we do as an institution and the purpose that we serve here about education, about creating new knowledge that really impacts the world, and about how we provide healthcare that is transformative and amazing and supportive of what our community deserves. And I believe deeply in this mission. And so when the chancellor wanted to pursue this and the Board of Regents was very interested in doing this, of course, the only obvious answer that I would have is why here, why now, why me? It would be, how can I help and how can I serve and how can I do this? Because when you're surrounded with the talent that you have, you can do anything. And we're going to accomplish big and bold things with what we're doing. And so in some ways, I'm an accident here, but in some ways, I have no other purpose in life other than being a grandfather and husband and friend and fly fisherman and all those kinds of things. I have no other purpose in life but to serve all of you and our community and how we're going to create a world-class university.
So to follow up with Taylor, first of all, Harriet and Austin, always great to be with both of you, and thank you for coordinating this evening together with John and Catherine.
Yeah.
Why am I here? Well, because of Graciela. She's always been my greatest advisor, and in fact, in 1995, when I was finishing my transplant surgical fellowship, Graciela and I spoke about where we should live. And even though I was offered a great job at Johns Hopkins Hospital to lead their pediatric transplant program right out of fellowship, Graciela and I felt it was so important to raise our children in South Texas and San Antonio, where our children could be, close to their cousins, get to know their grandparents, things that are absolutely valuable to Graciela and me. So we came here in 1995. My only goal was to make sure, of course, that my family was fine, but also to become the busiest pediatric surgeon in San Antonio. Andrew always talks about world domination, and when I got here in 1995, I just wanted to be the busiest pediatric surgeon.
And you were.
I got pretty busy.
Yeah.
What I did not expect was to be asked to put my hat in the ring to become president of the Health Science Center about 4 years out of fellowship. It was actually kind of an insane nomination, and I think I did it because I didn't know what I was getting myself into. But when I asked my father, what are the chances of becoming the president, he said about 1 in a million. And I go, great, because my only goal is to be the busiest pediatric transplant surgeon. And so, much to the surprise of Graciela and me, I got the job. And I remember I was incredibly nauseous, driving back, from Austin to San Antonio. So why why did I take on this administrative role, which is really a founding role for UTSA? I did it for a couple of reasons. Number one is we always have to reflect upon family. And for my father, who was on the Texas Higher Education Coordinating Board when John Connolly created the Texas Higher Education Coordinating Board, I learned, really the power of education and how education changes lives. And in fact, I've always said education saves lives. Second, University of Texas and this great city of San Antonio has given me and my family opportunities that no other university could have ever given. I mean, who in the world becomes a president of a university 4.5 years out of fellowship? It's like unheard of. People told me I was committing academic suicide by coming to San Antonio. This was in 1995. I think I proved them wrong. Only in the Lone Star State can these great things happen. And then, to have had the privilege of leading the UT system as chancellor. But where did I want to come back? I wanted to come back after that role to be back at UT Health San Antonio, to go back to being a transplant surgeon again, and to lead that, to its new, aspirations. When the Board of Regents decided, in their wisdom, to integrate both UT Health Science Center San Antonio and UTSA in this moment in time, I told Taylor, I think this is the most important decision the Board of Regents have made in 100 years. And when I was chancellor, Kay Bailey Hutchinson would often ask us, how do we create the next great university in Texas? And, she was a competitive senator. She's still competitive. And she wanted an additional AAU university in Texas. Because in her state, she said, New York has 7, California has 9, and Texas is so much better than those states. Why do we just have 3, which is Texas, University of Texas at Austin, Texas A&M, and Rice? Well, the answer to her question is actually integrating UTSA and UT Health Science Center San Antonio into one university. But we're not doing it for that. We're doing it because this is the greatest thing for our children in this community and in South Texas and for this region that we serve. No matter how you look at it, we're going to improve the quality of life, we're going to make lives better, and the economic, prosperity of this entire region is going to be multiplied because of this new university. So when Taylor asked me again, hey, Cisco, can I come by and just talk to you a little bit? This was like on Martin Luther King weekend. I go, sure, Taylor, it's Friday, you can come on down and go to Laredo. And he goes, I'd like to ask you a question. I go, hey, I'm here. He goes, I'm asking you to become the Senior Executive Vice President for Health Affairs in the healthcare system. And, I want to tap upon your experience, your knowledge. You and I have great chemistry working together. Can you help me in this journey?
And I also told you you couldn't say no.
Well, I said, we need to await Graciela's response. And when I asked her, she goes, you have to do it. Because it's true. You have to do it. And I told Taylor, this is an opportunity of a lifetime.
It certainly is.
There's no other academic leadership position, but for Taylor and for me, that is involved in such an important journey. Not to put another accolade on Taylor or not to put another accolade on me. We don't need any of that. This is really about our children and their children for generations to come. And if we do it right, if we do it right, everything we do for this community is going to just be so much better, and ultimately you can summarize it by, we will make lives better.
Thank
That's
you.
why I did it.
So let's build on that a little bit. We've been using, as we talk about the integration of these two great universities, the word transformational. So, and I hope that you all heard the deep commitment to pride of place and of service to South Texas in everything we do. We're very committed to that. So talk a little bit more, Dr. Cigarroa, about this transformation as it relates perhaps to healthcare, education, and even research.
Okay. So, it's transformational, again, and I'll go back to the phrase, education saves lives. And, for me, it's the greatest public health initiative, that we can provide to our children. So we'll start off with that, because we can transform one life that will change generations to come. When it comes to the educational mission, our students, both at UTSA, and Taylor can elaborate more on this, but our students at the Health Science Center campus are absolutely excited about the new opportunities and new educational journeys it can take upon. For example, if you're a medical student, but you want to really understand, for example, aerodynamics, artificial intelligence, engineering, these are disciplines that when you bring together, can lead to spectacular outcomes. Example, Bob Campbell, Melvin Smith, pediatric surgeon, engineer, trying to save a baby's life with a syndrome that's called June syndrome that doesn't allow the chest wall to expand. So these little babies, newborns, die of asphyxiation. And so Melvin Smith, the pediatric surgeon, and Bob Campbell, the orthopedic surgeon, who had a degree in engineering, came together and developed the titanium rib, which is transformational now in caring for children with chest wall deformities. So that's just, on the healthcare field, that's going to multiply multiple fold in so many different disciplines that, again, focused on making lives better. On research, you bring together the power that UTSA has in computer science and artificial intelligence. And you bring that together in our efforts, for example, in our NCI designated cancer center at the Mays Cancer Center. And scientists trying to develop new novel therapeutics to, essentially address, certain malignancies that are still unsolved. The power of the faculty at UTSA working with our, cancer scientists is going to accelerate the pathway towards developing novel therapeutics. So
Those collaborations are already underway.
They're already underway. And so this is also going to attract, venture capital. It's going to attract pharma. It's going to attract other industries that's going to basically catalyze these efforts. So, in a way, we can talk hours about this, but those are just 3 examples of how transformational this could be.
So let's pull that thread just a little bit to your point, President Eighmy. Where do you see the biggest opportunities, picking up on what Dr. Cigarroa said?
That's an excellent question, Jennifer. Thanks. I'm going to frame it this way. We are building a brand new university from 2 very fine institutions that have steeply positive trajectories already. So the momentum that we will carry into merger and going forward will be very powerful and positive. And we have this almost ridiculous opportunity and time to hit the ground with a new university and build the foundation of it accordingly so that we are best prepared for the future. And we're bringing 2 universities together that are relatively young and very complementary. They don't overlap in many of the things that we do. And the fact that they're so complementary means that when we collide them together in a positive way, we have all of this foundation that we are building that will help us be ready for a future where we always run around and say this, in addition to Andrea's fond refrain of world domination. We're really talking about this integration being this notion of 1 + 1 does not equal 1.8, or 1 + 1 does not equal 2. We are talking about 1 + 1 = 10. In 10 years, we want to have the equivalent of University of Michigan, or the University of Washington, or the University of California, Los Angeles, or the University of North Carolina, Chapel Hill. That is our trajectory of where we're going. Yet we have a unique set of circumstances that are deeply transformative because of who we are, where we are, who we serve here in the great state of Texas. We have opportunities, resources, economic growth, population growth that our counterparts around the country are desperately jealous about. And when I talk to folks around the country about where we're going with all of this, they cannot believe the opportunity before us because we have all of these positive levers we get to pull that are transformative. And let me point out probably the most important one. We are going to be a massively large academic university with a huge research enterprise and a huge clinical mission and a hospital and clinical operations and deep impact in the health enterprise here in our community in South Texas. But we also are going to be continuing to be the university that makes education available to all. So we are not going to be an exclusive university. We are going to measure ourselves by the opportunities we provide our community. And so we can differentiate in this space better than any other university in the United States. And we will have that as a deep advantage for us. And so the Carnegie Foundation just came out with a new ranking system of universities, and they still rank universities about their research prowess, and both UTSA and UT Health San Antonio are Carnegie R1 universities. But we are now also one of 21 universities in the United States that's called an opportunity university, because when our undergraduates come to our institution and they graduate with little debt and they land good jobs, their economic mobility is very, very powerfully positive. And so for us to enter this new world order as a new university with this differentiation of being a great research enterprise that innovates and brings discovery to benefit with this fact that we are going to be one of the biggest public universities educating so many of our community members here in South Texas. We just have this powerful combination of things that is so unique, and that's what will make us more transformative than any other university in the United States.
And just to follow up on that, we've been through these wonderful integration steering committees, self-reflection, and it's not very often that two R1 universities, which we know we're coming together effective September the 1st, 2025, it allows us to actually take a step back and become more nimble.
Yeah.
And become more innovative. And, you know, in our deliberations, it was unanimous that excellence and access to education are not counterpoints. They, in fact, can be synergistic. And if we do this right, Taylor, you know, we will be the AAU University of the 21st century.
And AAU is, for those who don't know,
the Association of American Universities. It's the 71, there are a couple of Canadian universities involved, but it's the very best 71 public and private universities in the United States. And truth of the matter is, sorry to digress slightly, you might have been ready to ask me this question. On day one, when we merge, we will be not all that different in terms of scale, magnitude, impact to UT Austin and College Station. We will be, everybody paid attention to that statement. We will be 40,000 students, 17,000 employees, an annual budget of almost $3 billion, with almost 3 million patient visits per year across something like 34 clinical enterprises around San Antonio, including our brand new amazing multi-specialty research hospital. We'll have an endowment of $1.3 billion. Well, maybe it's gone down a little bit. We will have an economic impact here locally of almost $6.5 billion a year. We will be doing almost $600 million of research expenditures. If you look at all of those numbers and compare them to Austin and A&M, some are close. We have some work to do to catch up. But if I were the president at UT Austin or the president at College Station, I'd be a little nervous about what we're doing, right?
Well, we're also 100
agree.
years younger.
Yeah, we're doing it in half the time.
Yeah.
Thank you for the
And-
catalyst of the regions bringing us together. That's the fastest way to keys to the kingdom, but we're not going to waste this moment at all.
So I know you're nervous that maybe perhaps endowments because of markets have come down a little bit, but after tonight, I think
That's
the
right.
endowments are going to go up.
That's right.
That's the way I see it. But the other thing, I can't believe I'm saying this, is a former chancellor of the UT system. I think Bevo's getting a little nervous.
That's right.
The Roadrunner.
And you know who runs faster, Bevo or the Roadrunner? Obviously, we know where that's going to go. Me. So, yeah.
Well, they've been mentioning money, and you may wonder who the heck this Andrea is. Just to level set, Andrea Marks is a true partner in this endeavor and one of the most mission-focused
Oh, she's-
financial leaders I have ever had the good fortune
She's
to
the
work
chief
with.
of everything.
Chief, also the chief operating officer and
That's
senior
what I mean.
executive vice
That's what I
president.
mean.
So,
Yeah.
so we are very much a partnership here at UT Health and UT San Antonio, and it's just been a joy since September 1 to partner
And
on
you
this.
all have been very kind about accepting me into the fold and tolerating my strange behaviors and things that I do, and don't laugh.
We don't get his jokes, except when he says that. No.
And you keep me on the straight and narrow, so I'm a lucky guy.
So let's actually pull on that a little bit again. I'm so interested, and I think people in the room, is most of us will never be president of a university, let alone such a large university. And we talk about these things, but what's under the hood? How do we create a shared, unified vision across these two distinct universities? What's next that we are working on?
Well, I think it's important to understand this. You're merging two institutions that have had a trajectory that is very positive, and you don't always find that in higher education, where an institution is off and progressing and developing and growing, and the fact that both are like that certainly helps the cause as we bring the two institutions together. But what's also interesting is that I think it's intentional at both institutions, is that the folks that we've hired are deeply altruistic, and they believe in the mission of our institutions, and they like each other, they get along, they believe in creating something substantive and profound. It's almost a selfless kind of approach to work and career and pathway, and the density of that kind of behavior at both institutions is immensely high. I've worked at 4 other universities. The morale and the intensity of belief in the institution and the loyalty to the institution and the belief in the purpose is so high, and we have to help by providing a vision for where we're going in 10 years so that people believe in the purpose and can buy in and can be part of getting there. The whole point of leadership is to empower our colleagues so that they can participate and help us go to where we collectively want to go. And it's all about people. And if you've spent the last 10 or 20 years building institutions with great people, that is 90% of where we want to go. And I think we have a purpose internally to present a vision of what we're going to be in 10 years. What does that 1 + 1 = 10 look like? But we also have an obligation to do that to our community, to our alumni, to our benefactors and donors, to the folks that send their children to be educated with us, to those that are treated in our hospitals and clinics. We have a requirement there too, to present a vision, and making lives better is a wonderful way to start in that space. But I don't think we could do this if we weren't as young as we are, and we weren't already on these positive trajectories, and we didn't have the corpus of such talented teams of folks across our two institutions. We're talking about 17,000 employees and 40,000 students, and they're a pretty happy bunch. I mean, this is a little scary, but it wouldn't be possible if we didn't have these foundations of excellence that we're building upon right now.
So just to follow up on Taylor, I've been around here long enough to be a part of two studies
Oh, right.
to merge, both UTSA and the UT Health Science Center San Antonio, and we learned a lot from those two separate studies. The first study was probably done in 2003, more or less, and we had two young presidents. I was one of the young presidents.
Oh, that's right. I forgot.
And UTSA was just beginning their takeoff on their strive to become an R1, and so the timing wasn't right then. Then, actually, as chancellor, we did a second study, and interviewed a lot of faculty and students and staff, and the conclusion was, this should definitely be, a landing point, but quite not ready. So, now that when the Board of Regents kind of voted on this in June, both universities were actually fully prepared to engage. And so when you actually speak to students and to faculty and to staff, going through those exercises actually made a merger become absolutely common sense. In fact, Senator Vanderbilt told Tater, "What took you so long?" but really, that kind of maturation and beginning to start thinking about this, it actually makes this merger make sense. It's difficult to merge two institutions that are being forced to merge. This is entirely not the case. Everyone is now prepared to actually become one single university because they can see, the great potential ahead of us. And that's the altruism, and that can-do spirit, that innovative spirit, and the willing to take risk. Because if you're not willing to take risk, it's harder to advance the ball. Everybody is in on this game, and we can see that through the working groups of which, Jennifer, actually leads a very important, research integration working group.
It's important to understand this. We are really lucky that Texas is Texas. And we're really lucky about our Board of Regents who are very creative and audacious in their own right. And this is not their first big, hairy, audacious activity.
This is their best one.
It is, and it's the biggest one. And it's actually presently the largest integration of two universities in the history of higher education in the United States. It's that big. But what's really important is that the board has stepped up to do big things. They did back in the day with creation of UT Rio Grande Valley, but more recently the merger of UT Health Tyler and UT Tyler, the partnership between MD Anderson and UT Austin to build two new hospital towers on UT Austin land was a big deal. The creation of a new campus for UT Arlington and Fort Worth, the acquisition of Stephen F. Austin University. These are all big, bold ideas by the board deciding to put the best pieces of the University of Texas system on the table and rearrange them for the benefit of where Texas needs to go from an education, research, and healthcare enterprise equation. And so we're very lucky that our board thinks big and goes big, but they had to believe in our capacity to go forward. And frankly, they've told me, and I know they've told you too, this is your time, this is your moment, this is your agency. Don't screw this up.
Mother told me don't disappoint her.
Yes.
So final thought from both of you. This is the last question, then we'll be opening it up to a few questions. We have a little bit of time. Dr. Cigarroa, I'll start with you, and then President Eighmy, you'll wrap up. I'm interested. I see what we're doing now. What's the vision for our friends and new friends that we're here with tonight for 10, 15, even 25 years in the future for this university and the city because we're here?
So, we went through this exercise a little bit, but I think, 10, 15, 20 years from now, we are going to be, one of America's finest universities focused on excellence and access. we are going to provide, the most well-prepared pipeline, for the future of work, not only in Texas, but in America, whether it's in the STEM fields of the humanities or liberal arts, that, our science is going to be incredibly impactful, that could be translated from the bench to the bedside. It's called translational science or commercialization. And that in fact, the science that's created here is going to develop new novel therapeutics to cure certain cancers, hopefully many of them, and to have actually Nobel laureate discoveries here in San Antonio. There's no reason why that cannot be accomplished under this new, innovative, significant substantive university. In the healthcare ecosystem, we are going to be, this is one thing that's important to state, that UTSA will be the only university in Texas that also has within its umbrella a comprehensive academic health center.
Austin doesn't have that, and A&M doesn't have it, and we do by a factor of 50.
Manyfold.
Yeah.
But, we're going to create, really a magnificent healthcare ecosystem, for our children and for our loved ones, in San Antonio. So, this will truly allow no individual, no loved one having to leave this community, to get excellence in healthcare. And, we're pretty close to that now, but this is going to energize that. So no matter how you look across the mission of education, research, service, healthcare, we're going to be profoundly better at it in 5, 10, 15, and 20 years from now.
It's really important from a vision perspective to have a sense of what will look like, let's say in 10 years or beyond. And it's easy to say we'll be a top 10 university, we'll be like a Michigan or a UNC or a UC San Diego. We have all of these aspirant peers that we're looking at and borrowing their good ideas, but also bringing forward our own. And so you can benchmark it that way, but I want to frame it slightly differently, and it has to do with the future of this part of Texas and the future of San Antonio. We already, as separate institutions, but especially as a combined new university, have in some ways more agency in our community than almost any other institution except perhaps, let's say, HEB. I mean, we are at the size and scale and economic impact to be one of the most important foundational anchor institutions in our city. San Antonio, because the state demographer works for me, I do know this is true. We are about to become the 6th largest city in the United States. We're about to pass Philadelphia. And the fact that we do not have yet a combined, integrated, world-class university means we do have work to do, but we sit in the catbird seat here because of the entity that we're creating. And if I think about the impact that we will have beyond education, beyond discovery and innovation, beyond making lives better, we will also have a profound role in economic development, in workforce development, and in the creation of a foundation for our city and community going forward that is also world-class. And the notion is really important to understand here. Great cities need great universities, and great universities need great cities. And Daniel Patrick Moynihan once said, if you want a great city, build a great university and wait 200 years. We don't have to wait 200 years. We are here now, and think about what we will be in 10 years. And so I separate from our purely missional and moral focus on education and discovery and healthcare, we have this unparalleled moment in time to have a profound impact on where San Antonio goes as a community. And it's a great place to be. I think about economic opportunity and the economy of Texas being the 8th largest GDP in the world as an entity. I think about all of the in-migration population-wise and where the population of Texas is going. I think about the budget surpluses that we have. I think about how our legislature still is very supportive of R1 research universities. Our governor is a huge champion of this. We, in spite of complexities that are out there, we are sitting in a wealth of opportunity here, and it's ours to take full advantage of, to go forward, and that is why we're here.
So there was, I've got to quote Dr. Potter, in his marketing and branding exercise we had, they asked us, what would you like to see, again, this question 10, 15, 20 years from now. And Dr. Potter stated, wouldn't it be great that in that time period, in 1 year, we have 3 MacArthur Award recipients out of UTSA. And a MacArthur Award is exceedingly difficult to get, but it derives itself from the most innovative, impactful ideas that have actually happened.
Yeah.
And it can be in science, it can be in the humanities, it could be in the performing arts, it could be in literature. But to have 3, right? And I go, now you can actually see the faces, right? And
throw a Nobel laureate on top of that.
Throw a Nobel laureate.
Yeah.
But when you convey that to me, it just puts such a smile on my face, because it truly is not. It's not even aspirational. It can happen.
Plus, actually, that's in your job performance category of that's one of the things that you have to deliver on now, Jennifer. I just 3 MacArthurs. That's a KPI right there.
Isn't that's not even a stretch goal?
No,
goodness.
not for Jennifer. That's like that'll be easy peasy for Dr. Potter.
I hope you all know you don't apply for a MacArthur, you don't advocate for a MacArthur, you just get one day and find out that you're a recipient. So I'm glad to know I have a really clear target.
But it's also driven by the culture that you create that drives
Indeed.
excellence.
And I think that's why this is so extraordinary, because what we're doing as a university is holding ourselves to the very highest level of service, of standards, of excellence. And with these 2 leaders, we are well on our way. And I just want to thank you both so much. And we have a little bit of time for questions, but thank you, President Eighmy and Dr. Cigarroa.